Dementia affects millions of people globally, leading to severe declines in memory, thinking, and the ability to carry out daily activities. While age, genetics, and lifestyle factors are well-known contributors, what many don't realize is that some common medications can also increase the risk of developing dementia or worsen its symptoms. These medications can interfere with brain function, disrupt critical neurotransmitters, or cause harmful side effects that mimic dementia. Whether prescribed for anxiety, pain, allergies, or other common health conditions, these drugs can have unexpected and serious impacts on cognitive health. In this video, we'll explore 15 medications that can cause serious dementia-like symptoms, with explanations from credible sources like the CDC, FDA, and other well-known organizations. Are you ready? Number 1. Anticholinergics. Anticholinergic medications are used to treat various conditions, including allergies, depression, and bladder issues. These drugs block acetylcholine, a neurotransmitter vital for memory and learning. The National Institute on Aging notes that long-term use of anticholinergics is associated with an increased risk of dementia, especially in older adults, as they disrupt the brain's ability to communicate effectively. If you're taking these medications, it's important to discuss safer alternatives with your doctor. Number 2. Benzodiazepines. Benzodiazepines such as diazepam, Valium, and alprazolam, Xanax, are commonly prescribed for anxiety, insomnia, and seizures. The Alzheimer's Association points out that long-term use of benzodiazepines can impair brain function, leading to memory problems and increased dementia risk. These medications work by slowing down brain activity, which can impair cognitive function over time. Experts recommend using these drugs cautiously, especially in older adults, and only when necessary. Number 3. Opioids. Opioids, including oxycodone and morphine, are powerful painkillers used to manage severe pain. However, the CDC highlights that opioids can alter brain function, leading to confusion, memory loss, and an increased risk of dementia, particularly with prolonged use. Opioids bind to brain receptors that regulate pain and mood, but they also slow down cognitive processes. It's crucial to use opioids only as prescribed and explore other pain management options when possible. Number 4. Antidepressants, tricyclics. Tricyclic antidepressants like amitriptyline are older medications known for their anticholinergic effects, which can significantly affect brain function. According to the National Institutes of Health, NIH, these drugs alter neurotransmitter levels and block acetylcholine, crucial for cognitive health. Long-term use of tricyclics has been linked to an increased risk of dementia, particularly in older adults. Discuss with your healthcare provider about newer antidepressants that have fewer side effects. Number 5. Antihistamines, first generation. First-generation antihistamines, such as diphenhydramine, Benadryl, are commonly used to treat allergies, colds, and sleep problems. The Mayo Clinic warns that these medications have strong anticholinergic properties that can impact brain function, leading to memory problems. Long-term use, especially in older adults, is associated with an increased risk of dementia. Consider second-generation antihistamines, which have fewer cognitive side effects. Number 6. Antipsychotics. Antipsychotics are used to treat severe mental health conditions like schizophrenia and bipolar disorder. However, the FDA has issued warnings about using antipsychotics in elderly patients with dementia, as they can worsen symptoms and increase the risk of death. These medications alter brain chemistry, leading to sedation, confusion, and increased risks of falls and other complications. Monitoring and adjusting antipsychotic use is crucial, especially in older adults. Number 7. Proton pump inhibitors, PPIs. Proton pump inhibitors, such as omeprazole, Prilosec, are used to treat acid reflux and stomach ulcers. Some studies, including those cited by the American Journal of Gastroenterology, suggest that long-term use may be linked to an increased risk of dementia. PPIs may affect the absorption of vitamin B12, which is crucial for brain health, and could influence amyloid protein production associated with Alzheimer's disease. Use PPIs only when necessary and discuss potential risks with your healthcare provider. Number 8. Statins. Statins, like atorvastatin, Lipitor, are prescribed to lower cholesterol and reduce the risk of heart disease. However, the FDA has reported cases of memory loss, confusion, and other cognitive issues associated with statins. While the evidence is mixed, some studies suggest that high doses of statins might impair cognitive function. Statins work by inhibiting enzymes involved in cholesterol production, which can also affect the brain's ability to produce essential compounds. Number 9. Anti-seizure medications. Anti-seizure medications, such as phenytoin and carbamazepine, are used to control seizures in people with epilepsy. The Epilepsy Foundation notes that these drugs can have sedative effects that impact brain function, leading to cognitive problems like confusion and memory loss. Long-term use of anti-seizure medications has been linked to an increased risk of dementia, particularly in older adults. Regular monitoring of cognitive function is essential for patients on these medications. Number 10. Beta blockers. Beta blockers, such as propranolol and metoprolol, are used to treat high blood pressure, heart conditions, and anxiety. The American Heart Association explains that while these drugs are effective for heart health, they can also cross the blood-brain barrier and slow brain function, leading to potential memory problems and confusion. It's important to choose beta blockers carefully and monitor cognitive changes, especially in those at risk for cognitive decline. Number 11. Corticosteroids. Corticosteroids, like prednisone, are anti-inflammatory medications used to treat conditions like asthma, arthritis, and autoimmune diseases. The National Institutes of Health, NIH, warns that long-term use of corticosteroids can lead to mood swings, memory problems, and even dementia-like symptoms. Corticosteroids alter brain chemistry and can cause significant cognitive changes over time. It's crucial to use the lowest effective dose and consider alternative treatments when possible. Number 12. Muscle relaxants. Muscle relaxants, such as cyclobenzaprine, Flexeril, are prescribed to relieve muscle spasms and pain. The American Academy of Neurology notes that while effective for short-term relief, these medications can cause drowsiness, confusion, and memory problems, especially when used for extended periods. Older adults are particularly vulnerable to these side effects, which can mimic dementia symptoms. Use muscle relaxants only as directed and for the shortest duration necessary. Number 13. Antihypertensives, certain types. Certain blood pressure medications, particularly those that affect brain function, can contribute to cognitive decline. The American College of Cardiology notes that drugs like clonidine can cause sedation and cognitive slowing, increasing the risk of dementia. Managing blood pressure is critical for overall health, but it's important to work with your healthcare provider to select medications that are effective without compromising cognitive function. Number 14. Diuretics, certain types. Diuretics, commonly known as water pills, are used to treat high blood pressure and fluid retention. The American Heart Association warns that some diuretics can lead to dehydration and electrolyte imbalances, affecting brain function. Severe dehydration can cause confusion, dizziness, and memory problems, which may be mistaken for dementia. It's essential to stay hydrated and monitor electrolyte levels if you are taking diuretics regularly. Number 15. Sleep medications, sedative hypnotics. Sedative hypnotics, such as zolpidem, Ambien, and azopiclone, Lunesta, are prescribed for sleep disorders like insomnia. The American Academy of Sleep Medicine explains that while these medications can help with short-term sleep issues, long-term use is linked to an increased risk of cognitive decline and dementia. They affect neurotransmitters in the brain, leading to impaired memory and thinking skills. And there you have it! These 15 medications can significantly impact your brain health and increase the risk of dementia-like symptoms. If you or a loved one is taking any of these medications, it's important to have an open conversation with your healthcare provider about the risks, possible alternatives, and lifestyle changes that can support your cognitive health. Remember, it's not about stopping these medications without proper guidance, but understanding the potential side effects and working towards the best possible outcome for your health. Check out the next video for more tips on optimizing your health and lifestyle.